have to tell you what Dr. Stern said when I came to see her, that my hip was bothering me. I said to her, truly, how many more good years do you think I have? And she had said, but why live it with pain? And that was the light bulb that made me consider, yes, do it. And we did. And here I am. Yes. My name is Elaine Hirsch, and in January of 2024, I had right hip replacement surgery with Dr. Lorraine Stern. Before surgery, truly, it was painful to get around because of my hip. And the more walking you did, just getting out of a chair was an effort. I had a right hip replacement, and when I had seen the first x-ray, it just was a white mass. You couldn't see a hip. And thank goodness, after surgery, I no longer have the discomfort and pain that I had, and I can move much. It's like 100% change. Yes. She was very, very easy to work with. She explained everything in layman's terms for me. She explained everything very well. Honestly, I had no concerns. I felt that she was the right doctor for the right surgery for what I was doing for me. I had met her in the emergency room when she worked with my husband, and that kind of cemented our relationship for surgery. And 2 years later, I needed hip replacement, and she was the only person that I considered to do the surgery. My life is fine now, certainly without any pain on the hip, and I have, full movement, and I'm able to get about quite well. Without question, I mean, if you feel that you need surgery, certainly go to a surgeon. But again, this is all very personal, the decision that you must make for surgery, because it's also elective surgery. For me, it was not emergency surgery. And I would say, no matter what your years are, do it without pain if it can be done.